common exam station, common exam. You enter into the exam station, you find examiner is telling this is Sheila. Sheila is an 11-year-old girl. Please do general examination.
Okay.
Now start. You have no time. 6 minutes is your time. Understand? General
Okay.
examination. Sheila, 11 years age old.
Okay. Dr. Emma,
Please
I don't
start.
know how to start with general examination. Can you
Okay,
give me?
okay, and then I'm doing that. So I enter into the room. I wash my hand and I'm greeting the examiner with smile. Hello, I am Dr. Emma, to the exam candidate. Then examiner give me this instructions. Okay. So then I start talking with the child. Hello, Sheila. How are you? What is your name? How are you? Then Sheila is telling that I'm fine. So that time actually I wash hand and mentality of the girl I am noticing that it's mentally well or not. And how about the any distress 4D distress, any device dysmorphic features and dimensions. So I find the child is very short, 11 years age corresponding, it is very short. Then it keeps in our mind, my mind that is going, it is short stature maneuver I will do. So any general examination, first we look at the neck. Neck we find no swelling. That means no thyroid these cases. Then I tell the mother is also there. Suppose mother is Fatima. Sheila, can you please stand for me? So Sheila standing. Then I look at the leg. I'm noticing is there any leg deformity, anything? So I don't find anything. Then going to the back. LBGM back, nothing I find. Then in back actually from neck, if I go, I find there is some posterior hairline, short neck. Okay. Then I tell, can you please walk for me? I can show him, show her. Then she will be walk and gait I find normal. Then the measurement only the standing height and the sitting height. Standing height he will be stand against a wall, suppose on the room, and I just standing and sitting also. I will give a she will be sit and the sitting height. Standing height by sitting height, that is, if we divide the sitting height, the standing height, if it is more than 7, it is disproportionate short stature, otherwise proportionate. Normally sitting height is twice than the standing height. Okay. So now, okay, LBGM I do, then go the general examination from hand. I understand from the beginning it is short stature, so I go short maneuver. Here is the difference. Okay. Short maneuver, first I tell him put your hands front on in front of you together, like any asymmetry present or not. I don't find any asymmetry in my case. Then make a star. Then I look at the hand. Is there hand any features? No, nothing. Make a fist. When she make a fist, then I find her fourth and fifth metacarpal bones are shorter. Her fourth and fifth are short. Then white carrying angle, I will show her how to do. White carrying angle, I find that means it is Turner syndrome Gomez, that is a girl. Then I tell mid thigh, he will be stand. It is reach to the mid thigh, no problem. Thumb to shoulder also she can do. So I find I would like to complete my. Then I understand the features. Okay. After hand examination, I go for the pulse. Is there any pulse like tachycardia, anything present or not? Look at the eye, head circumference, ear, everything. Then mouth. Then I will chest expose. From the beginning, I understand it is going Turner. Yes, child is short, white carrying angle. I find and I find that short fourth and fifth metacarpal bone. Then I expose the chest with permission of examiner, as she is a girl. White space nipple we can find in Turner syndrome. Then I will auscultate the chest, as we know, coarctation of aorta is associated with Turner syndrome. Then maybe time will be and I would like to complete my examinations by doing the four limb blood pressure measuring. And also I will ask the mother about the history any lower limb edema in the neonatal period, any special school, hearing assessment or having hearing aids. Okay.
Yes.
Then I'm telling how can I manage Turner syndrome. Examiner will ask, so present your case. Today I examine Sheila. She's a 9 years age old girl. She is well communicating me, and during my examination, I noticed that she is short for her age, and I find lost at ear. We can find webbed neck, low posterior hairline. Then I find on inspection there is white space nipple, shield, chest. Then pulse, maybe 3D pulse we can find. White carrying angle we find. And also we find in hand there is hyperconvex nail, short fourth and fifth metacarpal bone, wide carrying angle, and ejection systolic murmur, and lower limb examination is unremarkable. So putting together, it is a case of short stretchers. On top, it is Turner syndrome. DD, you can say or not Noonan syndrome. So how can I manage? First of all, I take the history of the patient. I will revise her note. What are the investigation already done? So some investigation I will do like karyotyping. I expecting 45 XO. Then lab we can do thyroid function test, random blood sugar, sex hormone. We find increased FSH, LH, and decreased estrogens. That is hypergonadotropic hypogonadism. Then we autoimmune disease screening, celiac, IBD, diabetes mellitus, vitiligo. We do the echocardiogram as coarctation of aorta and bicuspid aortic valve associated with abdominopelvic ultrasound like horse kidney, streak ovaries we find, ultrasound neck for goiter and hearing assessment for glue ear. Then multidisciplinary team I will involve like geneticist, cardiologist, nephrology, ENT for sensory neural hearing loss, speech and language therapist, SALT, ophthalmology, dietitian and GIT for celiac, endocrine, for diabetes mellitus, hypothyroidism, growth hormone for short stature, and estrogen for secondary sexual characters, liaison with the school, bullying, learning difficulty, educational psychologist, psychological support to the family. This is the management. They can ask endocrine problem in Turner, short stature, delayed puberty, hypothyroidism, type 2 diabetes mellitus. And treatment is growth hormone and estrogen. Okay?
Yes.